Patrik Hutzel from IntensiveCareAtHome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home. Otherwise, medically complex clients, adults and children at home, which includes home BIPAP, home CPAP, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, and home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management at home, and we also provide palliative care services at home. We are also sending our critical care nurses into the home for emergency department bypass services, and we have done so successfully in the past for the Western Sydney Local Area Health District for their In Touch program. Now, in today's video, I have a question actually that comes from an intensive care nurse who says, "Hi Patrick, I'm an intensive care nurse in Sydney, Australia. We know of a patient at home that is ventilated with a tracheostomy because the patient keeps bouncing back into ICU all the time. And that is why we have looked up your company, Intensive Care at Home, and we need someone that can manage his ventilator, change his tracheostomy at home, and keep him at home predictably, because clearly he doesn't want to come to our ICU, and we don't want him in our ICU because he's clearly blocking a bed and he doesn't want to be there. And we believe he's so much better off at home, but it also shows that he doesn't have the right support at home. Can you employ intensive care nurses at home to keep this man home predictably?" Right. Thank you so much. And this is from Amanda. Thank you so much, Amanda, for writing in. And yes, absolutely. This is bread and butter for us. So let me dig out a story from way back when I first started intensive care at home in 2012. We were trying to open doors, and then eventually I came across a client who was exactly doing that. He was at home already with a ventilator and a tracheostomy, and he was bouncing back into ICU all the time because he didn't have the right support at home, right? His team, which was a mixture of general registered nurses who are not ventilation and tracheostomy competent, and support workers, with all respect. I mean, support workers are untrained, and all of a sudden they've been asked to look after a ventilated and tracheostomy patient. That is madness, right? So this patient, or we call them clients, of course, went back to ICU all the time. And as soon as, we got in front of the client and we started working there, he never, ever went back to ICU ever again, because that is simply our model. Our model of care is intensive care at home. We are replicating an ICU bed in the community. It's a genuine alternative to a long-term stay in intensive care. And, our clients are at home predictably. That's when we can do our best work. Also, this is evidence-based. So have a look on our website at intensivecareathome.com. There is a section called the Mechanical Home Ventilation Guidelines. And on that section, you will see that there's enough research and evidence to showcase that only critical care nurses with a minimum of 2 years critical care nursing experience can safely look after ventilated and tracheostomy patients at home. That includes ventilation and tracheostomy. That includes tracheostomy without ventilation. And it also includes non-invasive ventilation, such as BiPAP or CPAP, right? It's the same in a hospital. You wouldn't have a patient with a tracheostomy or on BiPAP or on CPAP on a hospital ward without an ICU nurse. You wouldn't. Whilst it happens every now and then on some wards, they would still have a one-to-one special with an ICU nurse. So, right? So it's not any different in home care, right? And with intensive care at home, once again, the first services of intensive care at home came sort of in the late 1990s, early 2000s in Germany, and the research is from Germany. And I have worked in 3 different countries in intensive care, including in Germany. So, I've worked in Germany, the UK, Australia. The issues in ICU are the same. The patients are the same. So, in order to discharge patients safely from ICU, you need critical care nurses 24 hours a day in a home care environment. It's very simple, very straightforward. And it's also way more cost effective than staffing an ICU bed. ICU bed, $5,000 to $6,000 per bed day. Intensive care at home is approximately 50% of that. So once again, it is an absolute win-win situation. And we have case studies, Amanda, that we can help your ICU to achieve what we're achieving for all of our other clients, which is keeping them home predictably and keeping your ICU beds empty, and you won't even pay for it, right? It's a win-win situation. You have an empty bed, patients and families improve their quality of life. Once again, win-win situation. Now, with intensive care at home, we are currently operating all around Australia in all major capital cities and in all regional and rural areas. We are an NDIS accredited intensive care at home nursing service. We are a TAC and WorkSafe approved nursing service in Victoria, ICare in New South Wales, and IISQ in Queensland. We're also a DVA approved service provider all around Australia. Our clients have received funding through public hospitals, private health funds, as well as departments of health. Intensive care at home in 2024 is the only service provider in Australia that is accredited for intensive care at home nursing. There's no other organization in the country in 2024 that has achieved the same level of accreditation than we do, or that brings the same level of skill in the community. We're employing hundreds of years of intensive care nursing experience combined in the community. I believe that is unmatched in 2024 in Australia. Most of our staff have a postgraduate critical care qualification. Approximately 70 to 80% of our staff have completed a postgraduate critical care qualification. Once again, I argue that is unmatched in the community, and that enables us to look after the highest acuity clients in the community in Australia. We're also providing level 2 and level 3 NDI support coordination, which is critical for most NDIS participants to obtain the right level of funding and the right level of support they need. And if you're at home already with a ventilator, with a tracheostomy, or with a tracheostomy without a ventilator, or with ventilation, BiPAP or CPAP without a tracheostomy, or you or your family member is at home already and you don't have enough support, you're struggling staying at home predictably, and you think you have enough funding, you don't have the right team, please reach out to us at intensivecareathome.com. We have the expertise in building the right teams, obtaining the right funding. That's all part of our skill sets. Otherwise, we would not be in business. So I strongly encourage you to reach out to us as well, because we keep our clients at home predictably so that you don't go back to hospital or to ICU. Or you can go home, of course, if you are in ICU. Our success rate in keeping patients at home and our clients at home is very, very high. And if you're an NDI support coordinator and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care, I also encourage you to reach out to us. We can help you with the advocacy, and we also provide specialist NDIS nursing assessments. And if you're a critical care nurse and you're looking for a career change, we're currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, Bendigo in Victoria, as well as in Warragul and Leongatha in Victoria. If you have worked in critical care for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care qualification, we will be delighted hearing from you. Please keep in mind, we are offering a tailor-made solution for our clients, which includes regular staff. Our clients want to have the same staff coming to their home over and over again, because they are very vulnerable, and it's all about building those critical relationships, having regular and stable teams. So if you are looking potentially for agency work where you can come and go, this may not be the right fit for you. But if you're interested in a long-term engagement with us and a long-term engagement with our highly valued clients and their families and building those critical relationships, then this is a win-win situation for everyone. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We are currently expanding our medical team as well. If you have bed blocks in your ICU and you're an ED or ICU consultant, we can help you eliminate some of your bed blocks for long-term patients or for patients that come in frequently. We can help you take the pressure off your ICU and ED bed blocks, and in most cases, you won't even pay for it. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, please reach out to us as well. We help you with our critical care nurses taking the pressure off your bed blocks. And if you're in the US or in the UK and you're watching this, we want to hear from you as well. We can help you there privately. Please reach out. All of that you get at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video, and comment below what you want to and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you are a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.